Yeah, my name's Lynn. My name's Lynn Cowles. I am a program coordinator with the health coverage program at Foundation Communities, and we want to make sure that everybody has health coverage. Unfortunately, we've got some really high rates of uninsured people in Texas. We want to drop it. We want to help make sure that individuals know how to navigate this complex world of health insurance and make sure that communities can remain healthy in the state.
Well, I'm glad to have you here.
Yeah, thanks for having me.
The first time we spoke, the quality wasn't that great.
Sure.
But I was really excited that I did get in touch with you, at least for one important reason.
Mm-hmm.
So a lot of times when I'm talking to the guys, and the women as well, I tell them that rather than me just give them like a list of numbers, resources, contact information,
Mm-hmm.
because programs, policies change so frequently, people
Right.
move around. I tell them that what's more important is for you to learn how to search
Mm-hmm.
and find information.
Right.
And in a lot of the bureaucratic organizations, you end up with people who, it's just a 9 to 5.
Right.
They're not really invested in helping people.
Mm-hmm.
And so I tell them, but don't take that as an indication that like the system just sucks. You just got to find that person
Right.
who is willing to help and answer questions. So when I talked to you, I was like, oh, you are one of those people.
That person, right?
You are one of those people.
Right.
I mean, you and a couple of other people I've met over the years, I'm like, I got to talk to them.
Cool.
Because you seem like good answers, great speaker,
Yeah.
full of information.
Well, I feel good about that. It's
Yeah.
working, right? Yeah.
So you've been doing this for quite some time, like right out of college or...
Well, so I was in graduate school at UT and was working in nonprofits while I was in school, and so I was doing this job in health coverage on a very sort of like client-based level. In 2015, when I finished grad school, I continued with this job afterwards, and so since then have been working as an enrollment specialist and then as an outreach specialist and now as a program coordinator for the health coverage program. So it was not like right out of undergrad, but I was kind of doing this work while I was in graduate school and then have continued now. Yeah. So it's been 6 years, 7 years. Yeah.
So if you could tell me a little bit about just what are some of the broad strokes of what you're doing and we'll cover all the different names
Cool.
of the Affordable Healthcare
Yeah.
Act and all
the
that.
acronyms.
Yeah, so one of the good things about talking to you is you know exactly what needs to be said. And some of the other times when I speak to people, I need to generate the questions that really pulls the information, the substantive information out of them. But you speak to people quite often. You know exactly what people need to know.
Sure.
So when it comes to getting hooked up with health coverage, coming out of prison, what are some of the finer points that people need to know?
Yeah, so I think just more broadly, the Affordable Care Act sets up financial assistance so that people can pay for health insurance, and that's like in a very kind of like basic sense. So because in the United States traditionally health insurance has been attached to employment, for people who have employers that don't offer health coverage, either because they are a small business or because the person is a part-time employee, or if somebody's self-employed, obviously most people can't offer themselves health insurance,
Right.
Or if people are not working, then the Affordable Care Act is there for those folks, and the Affordable Care Act is the policy that set up this financial assistance to help people pay for private health insurance companies that sign on to what's called the marketplace. And so the marketplace is the sort of like digital platform / relationship network between private health insurance companies that allow people who don't have offers of employer coverage to get into those plans. And then oftentimes, because health insurance is so expensive, and if a person doesn't have an employer helping them pay for it, then it would be too expensive to purchase. So the federal government steps in and helps people pay for their plans. And so the amount of financial assistance that someone gets depends on their income, depends on their tax household, very specific relationships that oftentimes make applications and financial assistance amounts very specific to each individual or each family. Now, normally for somebody to get into one of those plans, they would have to enroll during the open enrollment period, which happens every year from November 1st to December 15th. And there's talk right now of that end deadline actually being extended. So that'll be an update for later if we need to. But so the open enrollment period is for folks to get into plans normally if they don't have an offer of coverage from an employer. But there are they're called qualifying life events. wherein if people experience one of those, they can get into a health insurance plan in the middle of the year. And the logic there for the health insurance company is they don't want people to enroll in health insurance plans only when they get sick, right? So they have this open enrollment period so that people get into the plan, pay for it throughout the year, and then use it if they do get sick or for preventive care and what have you. But the qualifying life events allow people to get into plans outside of that open enrollment period. And so qualifying life events include losing coverage from an employer if somebody quits their job or gets fired or whatever. If somebody has a tax household change, like having a baby or getting a divorce, and so if you lose a prior spouse's coverage. And then for people who are leaving incarceration, because the state, to some extent, is required to be responsible for people's health care while they are incarcerated. When people get out, the state recognizes that you didn't have health coverage before you went in, depending on how long you were in or whatever. So they open up a special enrollment period for individuals who become unincarcerated to get into health insurance plans. Now the window is 60 days, right? And becoming unincarcerated, there's a lot of transition, there's a lot of steps that people need to take as they go through that process, but the window is 60 days regardless of all the hurdles and obstacles that people are approaching when they get out.
Yeah, 60 days from the time that they are released, they have this this window of time when they can enroll for health coverage outside of the normal November to December time.
Yeah, and it's called a special enrollment period. Okay. Yeah. Go ahead.
Yeah, there's just so many things. So one is that I like what you said about the fact that what they will actually pay is going to be relative to a bunch of different variables.
So many factors, yeah.
So children, spouses, who else is in the household, their previous history, because there's oftentimes rumors and information that circulate the prison, and there are quite a few letters that say that when they get out, they can apply for all of these different things, and there's a set amount, they'll receive X amount of dollars within 48 hours. It's kind of crazy, but those things fluctuate so often, and they're also, like you said, relative to a number of variables. But the point is, they need to get in touch with somebody like yourself within that 60-day window so that they can get health coverage. So what is your title, and when a person gets out, who should they be looking for? What organizations? What are some of the generic names? Because I know you work for a particular entity, which is, one of many entities. So if somebody's getting out,
the sort of like genre of entity, right, or the category is called an assister organization. Yeah. So the program that I work for is a federally recognized assister organization, and the way that people can find assisters, and this is another tricky part, it's like part of information literacy and like knowing how to search for things, like you said. You can go to healthcare.gov, which is the website for the marketplace, right? For that kind of like network between the private health insurance company and the US Treasury that helps people pay for their health insurance plans. If you go to healthcare.gov, there is a button on there that says find local help. And you want to find an assister that's local to where you are, because they're going to have all of the information about plans that are available in the area, or if people for some reason don't qualify for the marketplace, for instance, they're undocumented, or if they're eligible for Medicare, then the local assister will be able to tell people about other organizations and other programs in the area that can help people get coverage if for some reason they don't qualify for the marketplace. So you want to find the local assister, so you go to find local help on healthcare.gov, and you put in your zip code, and it lists there then a bunch of different people. It lists assister organizations, but it also lists agents and brokers. Agents and brokers are sometimes awesome, right? Like they also get people into health insurance plans. They oftentimes know their stuff, but they're not regulated the same way that assister organizations are, so they don't have to pass the same kinds of training that assisters have to pass. And because agents and brokers oftentimes work for private insurance companies, they get paid every time they enroll somebody. So they won't necessarily give people like the full extent of their options. So for instance, in Travis County, in Central Texas, if people have a Travis County address, there are 6 insurance companies from which they can pick one of many different plans. But if an agent or broker is only licensed with 2 of those, then they might only tell you about those 2 companies. So you want to find a local assister organization, not a local agent or broker, because the agents and brokers are oftentimes going to give people limited options. And then, go ahead.
Yeah, so I'm glad you made that distinction because I was unclear about the distinction as well. So there's an agent and a broker, and then there's someone like yourself working for an assister organization.
Right.
And so those three offices can get people into health coverage, but one of them is going to be limited in a variety of ways. So what is your title and how do you function?
Right. So so I'm a certified application counselor. That's what everybody in our program has to be. So on healthcare.gov, when you go to that find local help option, you put your zip code in, and then there are two checkboxes at the top. There's a checkbox for for agents/brokers, and then there's a checkbox for assisters. So you want to uncheck the agents and brokers tab and leave the assister tab or the assister checkbox checked. And then that'll filter your search results for organizations like the one that I work for, which is called Foundation Communities. We use hundreds of volunteers and about 30 staff members each year. We all have to get certified as certified application counselors. And then my role specifically in the program is program coordinator. So if you people who are in Travis County or honestly anywhere in the state of Texas can give us a call. We have a really well-functioning phone system right now. So we've been enrolling people from all over the state. But again, people in El Paso will probably want to call an El Paso assister because they'll know about the specific companies that are available there. They'll know about other programs for folks who don't qualify for marketplace coverage, and also other community resources. You know, so if people have needs for educational assistance or job finding assistance, the assister will, because they are nonprofit organizations and are not required by the law right now, but are able to do that extra community engagement work, they can tell people about those other programs too. And agents or brokers kind of like end with the health coverage question. So assisters are kind of like not offering wraparound services themselves, but can hook people up with organizations that can.
Yeah, that's a great point. It's another point that I've experienced in trying to work with people who come out of prison and they can go all over the state. That there's it's not reasonable for me to become an expert on all of the services across the state. It's best for me to understand certain people within a local area like Houston, Austin, San Antonio, because they're just going to have their finger on so many more resources and able to keep up with the various programs going on in their locale.
Yeah, exactly.
So certified application counselor is the title. A sister organization is the broad name, and yours in particular is Foundation Communities.
That's right. And then just to throw another word into the mix, there are also navigators out there. So a certified application counselor organization goes through the exact same training as a navigator, but a navigator gets federal funding. So over the course of the last 4 years, before the recent administration change in Washington, the federal government had cut funding for navigators by 90%. So there are fewer navigators right now than there have ever been, but just everyone should know that a navigator and a certified application counselor are the same thing. So you can find any assister organization with navigators or certified application counselors. And in the next few months, like even coming up to the upcoming open enrollment period that starts November 1st, there is now, I think, like $23 million more available for people for organizations like ours to become certified as navigators. So we did apply for that funding. We'll learn actually this Friday if we got it or not. In which case we would transition our program from being certified application counselor based to navigator based. But both of those terms are equally relevant in people accessing the information and the assistance to get into affordable health coverage programs. Yeah.
That's actually another great distinction that you brought up. This is why I like talking to you.
Yeah.
Because so my title is transition specialist.
Okay.
A transition specialist you might find on a college campus, and their job is to help students once they graduate transition either into the workforce or into schools. Well, I work in the prison system. My title is college lingo, but I'm functioning as a reentry specialist. I'm essentially doing the same thing, but navigator is one that I've come across in the college world as well. Navigators, transition specialists, reentry specialists, I hear all of those terms, and they're all sort of functioning in the same way. They are trying to help people navigate the landscape whatever resources they're trying to get into.
Or whatever field, right? So there's like an employment navigator, there's a health coverage navigator, there's like a mental health navigator, there's all those,
My daughter is hearing impaired, so she went to the Texas School for the Deaf for a little while, but when she gets to like senior in high school, they have a navigator or a transition specialist who helps them navigate those resources as well.
Right.
So all of these terms, I'm glad you're bringing them up because it's important so that people understand it's just very complex.
Right.
So you've got
the terminologies overlap, which is why information literacy is just so important, learning how to search, knowing how to search.
So healthcare.gov, you're looking for sister organizations. You go to local areas, zip code, you want to find a certified application counselor. There are also agents and brokers, but they are distinct in a number of ways. And then certified application counselors, sister organizations, and navigators are also functioning. It's
a mouthful,
Right. All right, so we've gone over a qualifying life event. So getting out of prison qualifies you outside of the normal enrollment period. The normal enrollment period is November 1st to December 15th.
Right now,
That might be extended.
It might extend to January 15th for this upcoming open enrollment period.
Okay.
So it could be as soon as this year. Yeah.
And then what they're actually going to pay is going to be relative to a number of factors.
Yeah.
So when I got out of prison, I was young. I did not have a lot of health issues, and so I wasn't concerned with it. But I did have it through employers, but there was the cost that I didn't even want it most of the time because it was just taking a huge chunk out of my check.
Right.
But now that I'm older and I have a daughter, it's much more relevant to me. But I think some of the guys who were coming out of prison, the healthcare that they got while in prison may not have been great. And so having some kind of health coverage so they can get some of these physicals and checkups and testing. So if you could say some of the things that come with just basic coverage.
Yeah. So one of the excellent things that the Affordable Care Act did was standardize certain parts of health care as necessary for a person's good living arrangements, right, and for their good health. And so by standardizing a long list of what are called essential health benefits, the Affordable Care Act guarantees that people have access to low-cost or no-cost medical care, no matter which plan they pick. So this is getting a little bit into the nitty-gritty, but there are different levels of plans where the lowest cost ones oftentimes have high deductibles and high out-of-pocket maximums, and so they sort of function as emergency plans for people who maybe are not necessarily going to go to the doctor if they get a sore throat, but if they get into a major accident and end up in the hospital for a month, they are protected from major medical debt by their out-of-pocket maximum. So even if somebody gets into one of those very low cost, sometimes $0 per month plans, so people just have it then. They don't have to think about it, they don't have to worry about paying for it because the amount of financial assistance that they get from the federal government actually it eclipses the cost of the plan itself. So the government pays for the whole cost of the plan and the individual doesn't have to pay anything. So even if somebody gets into one of those really low cost plans, there are essential health benefits built into them. So if somebody is traveling anywhere in the United States outside of the regular network that they can go to be covered by that plan, if somebody has a life-threatening illness or injury anywhere in the United States, they can go to a hospital and get covered at in-network prices. So they're still protected by their out-of-pocket maximum, even if they're outside of Texas or outside of, some plans are local to even Travis County, right? So the coverage for life-threatening illnesses and injuries anywhere in the U.S. is big. Also, the coverage of pre-existing conditions. So people will not pay more if they have diabetes or cancer or asthma or any pre-existing condition. That was part of the Affordable Care Act also. Preventive care is free, no matter which plan people choose. So free annual physical, free blood pressure checks, cholesterol checks, all the things that people need to really keep them in the know with their healthcare, so that they don't let a condition, get more and more amplified over time, and then they end up in the hospital, right? So that's what we want to avoid, and that's why preventive care is so important. And preventive care is free. So even if somebody gets a plan with a $6,000 deductible, you can still go get a free physical. You can still go get a free cholesterol check, right? And there's a long list of preventive benefits that are covered, that the companies have to cover because they were decided by a board of physicians and then adopted by the Affordable Care Act. And then the last one really is, there's 10 essential health benefits, but these are the kind of 4 that I focus on. Well, I guess 5. Mental health care parity is the part of the law that requires that people can have access to mental health care visits with therapists and counselors at the cost of primary care. So it's not a specialist care, which is always more expensive with people's co-pays. So mental health care parity is the term for that, which basically just means that insurance companies have to let people get charged for mental health care at the same cost as their primary care doctors rather than a specialist, like a cardiologist or an orthopedic surgeon or something. And then last is the existence of the out-of-pocket maximum, just in general. So health coverage is connected to financial health as well, right? If people do spend a month in a hospital, an average day in a hospital is like $23,000. And so if somebody spends a week in a hospital, you're looking at $150,000 potentially of medical debt. But no matter, again, even if someone picks the plan that has the lowest monthly premium, if their out-of-pocket maximum is $8,000, which is a substantial amount of money, but it's not $150,000, you know? And then if somebody gets into a plan where maybe they pay $20 or $60 per month, and that plan has an out-of-pocket maximum of $2,000 because they're willing to pay a little bit more per month, so the health insurance company meets them by saying, okay, we'll lower your out-of-pocket maximum because you're paying us more per month. Then if that person has $150,000 of a bill from a hospital, the max that they'll pay is $2,000. And then the insurance company has to cover them 100% for the rest of the year. So there's like all these protections built into the Affordable Care Act that require the health insurance company to cover people with all of these kinds of different conditions and life circumstances, which is why it's really important to just like know that that is out there, even if you're paying $0 per month.
Sure.
Yeah.
The mental health one was important. I want to say the first time, well, not the first time, but one of the times I went to a mental health specialist, it was not a part of my insurance plan under my employer. Yeah. And I got hit with like a $500 bill or something like that, and didn't want to go back. So with my current employer, it was just built into the plan. Yeah. So making that distinction is important, especially for people coming out, because sometimes they end up qualifying for various types of benefits or programs because of anxiety, or even some people coming out of prison might be diagnosed with PTSD. Sure. Different things related to trauma and anxiety. So the mental health part is really valuable. Yeah. So a couple of friends of mine have served a couple of decades in prison, and when they got out, that's essentially what some of the people they spoke with told them is that generalized anxiety disorder, post-traumatic stress syndrome after spending 2 decades in prison. Totally, yeah. So the mental health benefits is really crucial. Also, could you say a little bit about, well, one important thing you did mention was that this is the government working with the private insurance companies to help people get on those same plans as everyone else. So it's not, so I think a lot of people may have heard of Blue Cross Blue Shield. People are going to be able to get insurance through Blue Cross Blue Shield. It's not some other company. It's things you've heard of in the past. It's just that the government is working to help you get into these plans. Right. When you talk about plans, are there some broad strokes of different plans out there? I mean, I know there's going to be different factors in terms of what people pay, but are there some broad strokes you could explain, different kinds of plans? Yeah, certainly. So, and just to be clear, you mentioned Blue Cross Blue Shield. Blue Cross Blue Shield is available to anybody in the state of Texas. In some parts of Texas, it is actually the only Affordable Care Act plan that is out there. So it's the only plan that people can purchase with financial assistance from the federal government. But it is Blue Cross Blue Shield, the same company, but the Blue Cross Blue Shield on the marketplace is an HMO versus the Blue Cross Blue Shield that employers often offer, which is a PPO. So now it's like acronym city, but here we go. So an HMO is a health maintenance organization. A PPO is a preferred provider organization. So on the preferred provider organization, the way that the pay structure works with the company is basically an individual can go to any doctor and get, as long as it's like within a certain list of things, you can't necessarily go to like an acupuncturist, but on some plans you can. Right. Yeah. So if
You go to a doctor on the PPO, no matter what doctor it is, the health insurance company will split the cost of that visit with you. And whatever the individual's cost is contributes to their deductible or to their out-of-pocket maximum. And then if anybody ever did pay for so many different doctor's visits or whatever that they reach their out-of-pocket maximum, they'd be covered 100% for the rest of the year. So that's the PPO. The HMO, unlike go to any doctor, the HMO has a list of doctors that an individual can go to in order to be covered by the plan. So the Blue Cross Blue Shield HMO that's available on the marketplace has a very distinct and very well-defined list of doctors that people can go to in order to be covered by the plan. And then on the HMO, people do have to see a primary care doctor in order to get a referral for a specialist, if they want to see a specialist. On the PPO, you want to go see a cardiologist, go for it. The plan will pay for it.
Sure.
On the HMO, you have to pick from a certain set of cardiologists. And before you can go see that cardiologist, you got to see your primary care doctor first, and they have to write you a referral. So there's a little bit more involvement there, which oftentimes works for some people, especially for people coming out of incarceration. Like, you haven't had a health insurance company recently. You don't necessarily know how to pick a specialist. So, and it can be really good for people to need to go see their primary care doctors often if they have health conditions that their doctor should know about. If you go see any random cardiologist, they don't know about you, they don't know about your health history. And so it can be really good sometimes for folks to have that sort of tight relationship with their primary care doctor and then get the referral.
Yeah.
And then there's an EPO in between those two different kinds, right? So the EPO sort of meets the covered individual in the middle. So on the EPO, exclusive provider organization, there's still a list of doctors that people have to go to in order for the plan to help them pay for it. But that list includes basically all the same kinds of doctors and whatnot, but people do not have to see a primary care doctor before they can see a specialist.
Okay.
So that's the distinction. So there's the kind of most regimented structure on the HMO side. It's a little bit looser with the EPO because people can pick any cardiologist, but from that specific list.
Yeah.
And then there's the PPO where people can go see whoever and the plan helps them pay for it. Yeah.
It is good for people to be connected to the primary doctor. So I was kind of upset about the fact that I had to go through my primary care to get to the specialist, whereas on a previous plan, I did not have to do that.
Right.
However, having seen specialists now for several years, they will just keep you coming back. So if you're not in connection with your primary care doctor who can, make referrals and help you understand them and vice versa, just going to specialists, they'll just keep you coming back.
For another test, for another imaging, and although the health insurance company helps people pay for those, there are still costs. You know, if your cost sharing split with an insurance company is 80-20, and it's 20% for the individual and 80% for the health insurance company. If you get a $5,000 x-ray, that's still 20% of $5,000 that you owe to that office. And now granted, that 20%, it's $22,000 or something. That 20%, it does contribute to the out-of-pocket maximum, right? So over time, if you needed a bunch of expensive MRIs, eventually you would hit that ceiling, and the health insurance company would have to cover the rest of it. But still, hitting that ceiling is whatever that cost is, a couple $1,000s, 4, 5, whatever it is.
Yeah, I couldn't see myself right now coming up with the out-of-pocket maximum for most of the stuff. It's just, even it's still a huge expense for most people.
Totally.
To reach that level.
Well, there have been some changes in the health policy recently. So federal policy is always still flawed, right? I mean, no one ever totally gets it right. So the people did try to sign on to the Affordable Care Act in the past, and it wasn't really a good fit for them, right? If somebody had an income that was even middle income, not high income, the way that the financial assistance works from the U.S. Treasury that helps people pay for their plans, it's based on, like I mentioned, a lot of different factors, household size, income estimate, and so forth. But if people have moderate incomes, even an individual making $60,000 a year or something, they're not going to be getting a whole lot of financial assistance to help them pay for a plan. And so if that person is in their 50s, plan prices increase as people get older just because of the cost of covering and treating an older person. Sometimes people would see $400 or $500 plans, and they're that's expensive, and that's totally true.
Yeah.
And so in the past, people sometimes just skipped out. Now, if somebody has an income of $20,000 as an individual, or maybe in a household of four, like $30,000 or $40,000, they're going to be seeing huge financial assistance amounts. So those are the families that might pay like $0 per month or $20 per month to insure a whole family. But for those people who have middle and high incomes, sometimes they would opt out and just say like, I can't afford that. You know, even if I'm making 60 grand a year, 500 a month is still a lot. But the American Rescue Plan, which was a federal policy that passed back in March of this year, it organized a third round of stimulus payments for people, if anyone's heard about that. It also increased the amount of financial assistance that people can get to help them purchase their plans. And it increased financial assistance for low-income folks, but also for high-income folks. So we're seeing now people being eligible for, you know, affordable plans that never had any financial assistance before. And it looks like, so right now those policies are in place till 2022. We assume, and you know, I personally assume, and then also like the indicators look like that assistance is going to be there to stay. So we'll keep everyone posted, you know, as we help people navigate their plans and use their health insurance throughout the year, track their deductibles and stuff. But we'll be announcing and we'll be like, you know, making sure that people know whether that policy is in place after 2022, but it is definitely in place for next year. So that's good news too.
And so when you say that you'll be announcing things, do you all, so your organization, Foundation Communities will have a page that does these kind of announcements. Does healthcare.gov also keep people updated on this information?
It does, yeah.
So where can they go when they want to find out current issues, what's going on?
Yeah, healthcare.gov is a really great source of information. And for people who have already enrolled in plans, people have been getting like hit pretty hard with messaging from healthcare.gov this year because there was like another enrollment period. There was this increased financial assistance. Any changes that happen in the policy, people hear about it through paper notices or through email. So people have been getting a lot of those communications from healthcare.gov recently. And then you can also always call your local assister organization. They'll know about those policy changes also, and can really explain what it means in like very specific terms to what the implications might be for somebody's life, right? Rather than just saying like, oh, you know, more funding for people whose incomes are high. Like, does that affect you though, right? Like, if I had unemployment benefits this year, that changes the amount of financial assistance that I qualify for, but that's a very specific part of the policy. So a good way to learn about these things is also just to call your local assister and say like, here's my situation, does this affect me?
Do you all have any sort of trainings or webinars where you talk to the public about just healthcare in general, signing up, but then also up-to-date information? Yeah,
for sure. So Foundation Communities, we did 2 town halls during 2021 and also 2 town halls during 2020. So we do bilingual English-Spanish town halls where people can, usually it's like our organization partners who will attend those town halls. They're virtual right now. We haven't really seen a need for them in person just because it's hard for people to take, you know, 2 hours on a Thursday to come talk about healthcare. But for virtual meetings, it's great. And so individuals can also come to those and ask all kinds of questions. So we do have those at least a couple of times a year. And then if we get that Navigator funding that I mentioned, we'll have a whole new staff wing paid for by the federal government to do outreach presentations just like that.
Okay.
Yeah.
Yes. Finding the right person in the right organization, especially when somebody gets out of prison and they've got to work on some of the basic material needs like finding transportation and a job and things like that. Having someone to go to get all this squared away is going to be vital.
Totally. Yeah.
Also, because like if I would have heard this when I was 24 coming out of prison, we have already talked about deductibles, premiums, out-of-pocket maximums. We're already, like you said, getting into the weeds of the detail.
Right.
I don't want that to scare anybody
No,
off.
right.
There are people like yourself who can explain all this. Don't be embarrassed.
Right.
It's difficult for a lot of people, you know, because there's homeowners insurance, car insurance, renters insurance, life insurance, health insurance. There's just so many kinds of insurance with all of their own policies and plans. It's just madness. Yeah. So not to be embarrassed, just because that's exactly what you all are there for. To help people understand and get them connected.
And like last week, we literally like people seek out our assistance. They have PhDs. You know, like the healthcare policy is complex. And the application itself, frankly, is clunky. Like it's not an easy thing to read through. Some of the questions are like a paragraph long, and they just ask you afterwards, like to assess where you are in this like very complex and sort of like muddy sea of like immigration status or whatever. So the application is clunky. The policy itself is very complex. So like we get calls from doctors, lawyers, all kinds of people who don't have access to coverage because they're maybe like starting up an independent law firm or opening up a small business or something. So nobody should feel any embarrassment. Like I have 3 advanced degrees and I didn't know what a deductible was until I started doing this job. Like it's just a confusing system that's in place right now, but we help people work with it.
And people who qualify for this, again, are people who don't have the option with their employer, which would include, you said, people who are self-employed, small business owners. But you did mention last time that there is an exception where an employer might offer health coverage, but for whatever reason, it's either not enough or not appropriate for a given employee. And so then those people could potentially qualify for coverage.
Yeah. So adequacy and affordability are the 2 questions of employer coverage. And it's tricky, right? Because some large employers had health insurance plans in place before the Affordable Care Act passed in 2010 that maybe didn't offer mental health components, or that didn't offer, even sometimes like coverage of pregnancy for women, right? If they were a big enough employer, sometimes the federal government allowed those plans to continue for them to constitute coverage for employees. But for anybody who's on one of those plans through like an IBM or another large company that decided not to like shore up their health insurance options for their employees, a plan without mental health care options is not adequate by the standards of the Affordable Care Act. A plan that doesn't cover pregnancy for women is not adequate, even for a man who's enrolled in it. So if a plan is determined not adequate, if it's missing a certain function, right, or if it's like a limited benefits plan that doesn't have an out-of-pocket maximum, like that's one of the essential health benefits that's written into the Affordable Care Act, that if somebody doesn't have that qualification in their employer option, then the plan is not adequate and they qualify for financial assistance to help them purchase a health insurance plan on the marketplace. And then the other question is affordability. So for the individual who's covered by the employer, so for the employee, if that offer of coverage from the employer costs, and the number is very specific, but I'm just going to round it out at 10%. If the plan costs over 10% of that person's annual income estimate for the year, then it's unaffordable. And then that whole family can enroll in marketplace coverage if they choose to with financial assistance. So if a plan is inadequate or if it's unaffordable, then the policy, the Affordable Care Act recognizes that and says, okay, well, we'll help you pay for an affordable and adequate plan. Yeah.
Could you say something about the terminology when talking about this? Because you've said several times, signing up for marketplace.
Right.
We've also called it Affordable Care Act, and then there's other.
So there's healthcare.gov. There's the marketplace, there's the Affordable Care Act, and then because of the administration that was governing it when it passed, it's also widely known as Obamacare. Yeah.
Okay.
And there are definitely people who call us and say, I don't want Obamacare, but I want to be on the marketplace. Or like,
I'm sure.
I don't trust the Affordable Care Act, but I want a healthcare.gov plan, right? And it's like, okay, well, let's break it down a little bit. And a lot of the work that we do is in education, like because health insurance is, again, it's like complex and varies by location also. So those folks, when they call in, we say, okay, cool. Let's not talk about Obamacare. Let's talk about the Affordable Care Act, right? And then eventually over time you go, okay, well, because it passed during this administration, it's sometimes called that. But what we're doing here is like getting you affordable health coverage, and so
I think
all 4 of those are the same.
Yeah, I think so. For the people coming out, like, regardless of whatever their political affiliations are, this is needed health coverage for them that's available,
right?
Regardless of whatever you think about it. It's available for you and anyone else, and it's really vital, especially if you have children and other, then you yourself are in need of some, dire health care.
And for kids, oftentimes, and this is also work that we do though, because we are tapped into healthcare systems, right, in the state and and in various locations across it. For people who have like low to middle incomes, oftentimes their children will qualify for Medicaid or for the Children's Health Insurance Program. And that's a big financial burden off of families. So folks who, don't think that their kids will qualify, or people who maybe just like don't think that they can afford coverage for their kids, like should come talk to us also, because we can help them do the assessment to see like if your kid might qualify for Medicaid or the Children's Health Insurance Program or CHIP, then we can help connect them with the office that can do that can get that application started too. So that's an important part of just like family financial stability.
Yeah, just as a general rule, when it comes to any of these entities with healthcare, whatever, you shouldn't make the assumption that you don't qualify for some program or some policy unless you have already spoken to someone who has made that determination, because things change.
Yeah.
So quick.
And then even if you have spoken to someone, check again.
Yes.
Because things change, you know? Yeah.
Or in a worst case scenario, the person they did speak with wasn't really hip to what's going on.
Totally.
And
yeah.
They themselves were not up to date on what was going on. So
right.
Constantly being in that, being in the mindset of, or being intellectually humbled, acknowledging that you just need to ask.
Right.
You just need to make the call.
And like get a second opinion, get a third opinion, get a fourth, like there are always, and you mentioned this earlier, there's like, eventually you'll get the person, right? Yeah. Eventually you'll find the person that like wants to do a good, be a good resource, right? For their neighbors and for their community members. And those are the people who like will, maybe go a little bit of an extra mile and like do one more search and find one more cash assistance program or something, So like those folks are out there. And if you get the exhausted, underpaid person first, like don't let that be the only source of information for you. Yeah.
Right.
Yeah.
All right. Well, I think we've covered quite a bit, probably an overload.
Yeah. Right. Right. But can I say one more thing?
Yeah.
For the 60-day rule, for the 60-day special enrollment period, that is for people when they become unincarcerated from a jail, a prison, a detention facility, or any kind of court-mandated program where if an individual didn't attend that program, they would be put back in incarceration. So if somebody is in like a sober living house or something and they must be there, then we have used release dates from those facilities also. So it's incarceration, and then it's also those other kind of like in place of incarceration facilities. Yeah.
That would be actually the last thing is what kind of identification does a person need to present or get enrolled in a plan? So
very basically, not much. Like people do have to know their social security numbers, but they don't necessarily need a social security card. If people don't know their social security numbers, and this happens sometimes with like new immigrants to the United States, we can push an application through and then they just have to verify the social security number afterwards. So it's good if people come when we're on the phone appointment. Eventually we'll see people in person again, but we're just not right now.
Right.
But so when we're on the phone with folks, it's good if they know like who's in their tax household. How much money they estimate that family, who all the income earners in the family will earn that year. And it doesn't have to be exact. It's a ballpark all the time. But so the household members, the income, any immigration information is really important. If there are undocumented people in a household, they'll still be on the application, but they'll just not be applying for coverage. Also, healthcare.gov does not share any information with Immigrations and Customs Enforcement, so people don't have to worry about, the information share being an issue. Yeah. And then, so the most important thing is social security number, because that's how the marketplace or healthcare.gov ties a person's identity to their application.
Well, let me ask you this. Yeah. Sometimes, at least in Texas, they're supposed to get a social security card, a birth certificate, and an ID. That actually only happens about half of the time.
When people are released?
When they are released from prison. Oh. So sometimes they may only have a prison ID, which is not useful in very many places. Right. They buy you cigarettes, but that's really about it. So that's why I asked that question. What do they need? Yeah. Just a generic ID, not necessarily a license, but a state ID license.
People actually don't need an identification card because the marketplace itself, when you enter a person's social security number into it, it verifies an identity using a credit history check. So it's not a credit report or anything. It doesn't show up on somebody's credit reports, but it is basically a list of questions about where have you worked in the past, or where might you have taken out loans, or where have previous addresses been. Now, for a person who's been incarcerated for 40 years, like, the marketplace might not actually have that information. They might not be able to locate somebody's employer from 60 years ago.
Or in my case, I got out when I was 24, but I went in as a teenager.
Right.
I didn't have.
You don't have a credit history, right? So in that case, we can push the application through by calling the marketplace, get a person insured, and then oftentimes the application itself then will ask for some kind of identity verification. So scan your social security card and send it in, or scan the prison ID, right, and send it in.
Sure.
For people who have recently been incarcerated and applied through that special enrollment period, oftentimes the application will ask for some kind of release date document. So if somebody has that on hand, great. If you don't have it on hand, that's okay. We can still send the application in, get somebody coverage, and just know that we have to submit that verification within the next month. Yeah.
All right. And your organization is in Travis County. You serve Central Texas generally.
Yeah.
And so the organizations that will help them are dispersed in different regions across Texas. So yours is located in Travis County.
Yeah, ours is in Travis County. And since we put together this really robust phone program during the COVID-19 pandemic, we have been working with people across the state. Because if somebody puts like ACA or Marketplace Assister into a search engine bar, our organization will be one of the first that pops up, just because we have done so much statewide work. So if somebody, even if they're in like Lubbock, or if they need to go, if they're released in Dallas and they head back to the Valley for employment and stuff, no matter where people are, they can call us, and we can either work with them through the application to help them see, what the options are, or if they want us to help them find a local assister in their area, we can help them do that too.
Great.
Yeah.
Well, I can see this is going to be very beneficial.
Good.
I'm going to spread the word as I go in and out of the prison system.
Yeah.
And hopefully as the channel grows, people will see this as well. We can do updates.
Sure. And are paper flyers important? Like, can you take materials in with you?
Yeah.
Okay.
Yeah.
Well, then I'll make sure that you have some paper flyers also.
Yeah, because
Cool.
I go between 8 different prison units.
Okay. Gotcha.
And then I write people all over the state. So yeah, flyers are
cool.
Information is great, and this can be one of those Travis County resources that I refer people to when they say, "I'm headed to Austin. What can you help me with?"
Right.
Foundation communities.
Yeah, and again, like even if they're headed to Amarillo,
sure.
Send them our way. Yeah.
Sure.
And there's not a great resource in the Panhandle right now, but
there's not a lot.
Yeah, right. Love the Panhandle.
Yeah.
Right.
Well, thanks so much for taking your time out and coming out here and talking to us. I think this is going to be really beneficial to everybody.
Cool.
And have you on again.
Yeah, I would love to. Yeah.
Yes.
Awesome.
Right.
And good luck. Yeah, everyone. Thanks.